Welcome to Ageless by Rescu. This podcast is devoted to exploring the science of rejuvenation, uncovering the most trusted experts, the must-have products, innovations, and technology in the field of vitality, aesthetics, new beauty, and cosmetic enhancement. How wonderful to be reunited with Dr. Nina Wines. Thank you so much for joining us on Ageless by Rescu podcast. How wonderful to have an expert like yourself on the show.
Well, thank you so much for having me. I'm very excited to talk about this broad and interesting topic. So thank you for having me.
So pigmentation is the number one search skin concern in Australia. It is the thing that most men and women feel plagued by in terms of skin concern. And you are a specialist in this area, and your clinical practice certainly has done a lot of groundbreaking work with lasers and treatments. Mm-hmm. Can you explain to us what is pigmentation and the different types of pigmentation that occur?
Sure. Pigmentation is just a very, very broad blanket term to mean any excess pigment on the skin. The common things that I see, of course, is a household term called melasma. And just in case anyone doesn't know, that's sort of like a brownie pigmentation of the skin. It was previously known as chloasma, which is, green when the skin goes green, but is more now known as melasma. So that's the common thing I see, but a really, really annoying and other massive issue is post-inflammatory pigmentation that occurs after acne or any insult on the skin, particularly acne and darker skin type. That's a very common type of post-inflammatory pigmentation that plagues people. It's a really, really difficult issue.
Dr. Nina, you mentioned melasma. I've often heard that melasma is a different type of pigmentation and can occur in different skin types or at different periods, like, for example, pregnancy. And so it requires a completely different treatment protocol. Is that correct?
That's absolutely correct. Melasma is a really persistent type of pigmentation. It used to be called the mask of pregnancy because it commonly came on around that peripartum period, but it can affect women and men. And it is extraordinarily common in many, many different types of people. And it just is it requires a long, persistent treatment regime because it does take a while to fade, as opposed to post-inflammatory pigmentation, which can respond a bit quicker to treatment.
So I suffered melasma. I had like a huge mark on my forehead, I want to say for years. And yes, it came up, it was before pregnancy. So it wasn't a pregnancy related issue. I think it was in response to, a lifetime of thinking that I had Middle Eastern olive skin and didn't necessarily need sunscreen. You've said to me before in conversations that we've had that really pigmentation knows no ethnicity, knows no age, knows no gender. Talk to me about what you see in Clinique and how you treat skin.
Yes. Well, look, exactly right. Melasma can affect all skin types, and to me, skin is just skin, and it just varies in its color and tone, and then treatment varies depending on the color and tone of the skin. And melasma knows no boundaries with any ethnicity but it is more common in people with darker skin types, because the darker your skin is, the more melanocytes you have in your skin. And effectively, these are little octopus-shaped cells at the bottom of your skin that emit their pigment into the surrounding skin. So the more you have of those, the more chance you have of developing pigmentation. So absolutely, skin is just skin. And for me, I just approach the problem that presents me in front of me. So whether that be, olive skin or dark skin type versus white skin type, there's, a vast array of different approaches that you take based on the problem that's in front of you. I hope that makes sense.
It does, because, when I first encountered pigmentation on my own skin, The treatment that I was offered was hydroquinone, and I went and saw a doctor, and the options to me were laser, which I was warned could actually overstimulate and actually worsen the situation, or bleaching my skin. At that time, and I'm talking about, I want to say 13, 14 years ago now. So I went down both paths. Is that correct? Am I correct that those back then, that was kind of your only two options? You could either bleach the skin or, do IPL and laser. Were they the only two options before?
Absolutely. And of course, people do try their own at-home options that they try at home, but generally that was the approach, just the topical bleaching agents in combination with use of lasers. But lasers have since been found to potentially make the melasma worse. In hands where they don't appreciate the different ways of performing laser for people with pigmentary problems, laser has to be done very cautiously with a lot of experience in different skin types. It's not a one size fits all treatment. It has to be done based on scientific evidence and what the literature shows works for the skin. So it's exciting now because there are many, many more options available for people to manage it. So
what do you do in your clinical practice now?
Yeah, I love treating melasma, but I have a very, very consistent approach. First of all, I think realistic expectations are required, and I use a combination of prescriptive and at-home treatments topically. And I also then have a structured plan after 3 months where some people with very, very severe melasma can be placed on a new oral tablet. It's not new, it's been around for a while, but now clinical evidence shows it's very, very safe. And that's oral tranexamic acid, used very cautiously in the right people who don't have risk factors. And then I can, after I've got those things going, I then have a structured laser routine that I would manage the appropriate lasers in the appropriate skin type that's in front of me. So it's a very, very consistent approach. And I think it's really important. A lot of people come to me and go, I used this cream for 6 weeks and it didn't work. But I say to them, look, you really need to use this cream for 6 months to see results. It's not a quick fix, but we will get you there. And I always just promise them that don't despair, we will get you there. This is treatable. It just requires time and consistency to get there. So that's important, just to say to people, just keep at it. It will, like anything, you'll get there.
I have a question for you. There's a term to describe skin type and I guess a universal language called Fitzpatrick. What is this for the layperson? Can you demystify this terminology? And because we might hear it if we go to see a dermatologist or a skin clinician, or if we're looking for products, what does it mean?
That's such a great question. And I'm very happy to answer it because Fitzpatrick is merely the name of the man who coined this term. And his name is Fitzpatrick. And incidentally, I did meet him once. I went to San Diego to visit a clinic, and there was Mr. Fitzpatrick sitting there, which for me was really interesting because all our textbooks had been written by Fitzpatrick. So all these thick, thick, thick books that I've been learning off by heart for so many years, there he was standing there. So it's the man who named it, and he's a very clever dermatologist who quite a groundbreaking procedural dermatologist. And it's simply a scale of 1 to 6 of skin color, with 1 being so white, and you go out in the sun and you sunburn straight away, to level 6, which is the dark skin type. So they would not tend to sunburn in the sun. So it's just a grading system of skin color and how the probability of burning. So that's simply what it is. And it's a very useful grading system for us because classically, skin types that are olive skin and above, which is around Fitzpatrick 3 and above. So olive is around 3, level 3, and 6 is dark, and 1 is white. So olive skin and above requires a very different, cautious approach to treatment compared to the really white skin type. So white skin, you get away with a lot of really full-on lasers, whereas the darker skin types, you have to be so careful not to generate too much heat and to go cautiously and slowly. And so that's why it's such a useful system for us.
And we talked about what you offer in your clinical practice, but I like this story, and we've talked about this before. I think a couple of years ago, we were in an event for Clinique, and you discovered a brand that we all know, we've probably all grown up with, Clinique, and you read a study that they published while you you were becoming a surf lifesaver or something. Tell us this cute story, because I like this story.
A lot of you may know that I'm, you know, my first skincare that I ever used at boarding school was Clinique, and it was quite trendy to use Clinique when I was at boarding school. We all used to carry our little bags down to the shower. It was quite a lovely thing to have, and so it was such a great honor for me to be asked to work with Clinique. And I was reading one of their studies, because they have amazing scientific process behind the brand Clinique. And I was actually able to visit their lab and see the technology behind this extraordinary brand. Not only are they very ethical, but they have a lot of science behind the brand. In fact, it was started by a dermatologist. So I was very excited to be involved with something that I believe and trust in. Anyway, I was reading one of their studies about one of their creams to reduce pigmentation. And it was really quite good clinical evidence to show that there is a 40% reduction in pigmentation with this particular product. And I became really interested in it.
40%?
Thought, yeah, and increased skin brightening, 90% hydration shown in the studies. But I thought, well, you know, I recently got my bronze medallion as a surf lifesaver, which is a questionable hobby for a dermatologist. But anyway, some girlfriends asked me to come along, so I did that with them. And I started to get early melasma and panicked. And then I thought, well, what greater chance to give this a go myself? So I got sent this product here, which is I have to read it because sometimes it's very much
it's a long name. I know. I've got it.
But Clinique Even Better Clinical Radical Dark Spot Corrector and Interrupter. And so I thought, right, I'm going to give it a red hot go. So because my melasma was just nice and early, I didn't want to start on the more intensive treatments. See, the problem that what we really struggle with as dermatologists is that a lot of the topical bleaching agents that we need to prescribe cause irritation, and it's irritation that causes increased pigmentation as well. So you've got to find this balance between treating the pigmentation but not causing too much irritation. So it's a little tightrope that you walk. So this product really interests me because not only does it have the technology to reduce pigmentation, but it also has the technology to soothe the skin. So it's sort of this combined complex. So I thought, look, I'll give it a go. And certainly it worked for me. I didn't need to progress then to the really strong medications. So I got onto it early. Some poor people, unfortunately, it's a little bit late when they have that really deep pigmentation, you know, that when you look like you've got a mustache, that sort of pigmentation. But this was fantastic. And yeah, I was really pleased to give it a go. So I like the packaging too. It's nice.
Can I ask you, what are the ingredients that will actually work on pigmentation without causing that inflammation and that, you know, bleaching where we don't want to see, you know, a white patch or a gray patch?
Yeah, I think most topicals, when used in an effective way, won't cause a white patch on olive skin. So I just want to reassure you, even if you're using hydroquinone, you're not going to end up with a big white patch on your skin. It's just not what happens. But the irritation is a very annoying problem that, as we've already mentioned. Some of the literature is now talking about a number of products, licorice extracts, for instance, is a common one that's talked about. Then there's kojic acid, azelaic acid, there's glycolic acids and salicylic acids, but all do have the chance to cause a little bit of irritation. But if used correctly with moisturizers and with other products that reduce irritation, it's very, very possible to manage your melasma without causing too much discomfort on the skin. So
So what's in the Clinique product that you like?
Yeah, so what's unique about this particular product is it contains CL302, which is this sort of new complex.
Could you say that again? What is it again?
Sorry, CL302. It's just a complex, and it's basically a complex of some active ingredients. It contains this brightening agent called UP302, and that is combined with some other ingredients such as vitamin C and glycosamine and some other very effective ingredients. But in addition to this product, as I mentioned, contains agents that reduce inflammation. And there's a heap of evidence in our scientific literature about green tea extracts, for instance, being very, very effective to reduce inflammation. So it's just the combination, like everything, it's the combination, it's the synergistic effect of doing everything together. And that's something that
Sorry, go ahead. Sorry. Do you know one of the things I was going to say to you is I've used this product before, the first generation of Even Better I used. And the thing that I found, and it gave me great results, but the thing is that, you know, we all get kind of distracted by newness and, you know, I want to try this, I want to try that. But the thing that you said to me, and I think it was a couple of years ago when we met at an event or it was at a function, you said, the most effective way to get a result is compliance. You've got to stick to something.
Absolutely.
So when I listened to you, I would follow a skincare regime. I would use the serum. I used my Even Better correctly, compliantly, together with my sunscreen. I got great results. But if you use anything sporadically, it doesn't work.
It's exactly right. And it's a really common problem that I face as a clinician is that people will come back to me and they'll say, it didn't work. And I said, well, how much of the tube is gone? Because if only a third is gone, then I know. So that's my first way of finding out how compliant they are. So I'll say, how much of the tube have you used? And then I'll say, you know, results take time. You need to stick with things. And with pigmentation, it's like, stick at it, like 6 months, 12 months, like keep going. And it will happen. The results will come, like anything, like exercise, like absolutely everything. So this is a common issue that we face, just trying to get home that message of realistic results and giving it time. Things don't happen quickly, particularly with pigmentation, but we will get there if you keep chipping away at it, for sure.
Going back to the ingredients and what works and what doesn't work, you know, in your clinical practice, obviously you're not a counter for Clinique. You do other things and you sell other products. And what would be a good regime that we could do at home that you would advocate? And what are some of the things that we should really steer clear of if we are prone to pigmentation?
Yes. So with pigmentation, it is a lot about what not to do. So I'd like to explain that first. Don't pick your pimples, because when you pick a pimple with olive skin and above, you're causing your pigment cells to release pigment, and that makes it so worse. So don't pick your skin. Don't rub the skin aggressively, because if you rub and scrub skin, you're going to cause those little octopus cells called melanocytes, which is like, literally are like little octopuses. They have these little beautiful arms that extend into the skin and release the pigment. You're going to cause them to release their pigment into the surrounding skin.
So just sorry to interrupt, would that mean like no scrubs with like granule? What are you, not too many peels? What about things like gua sha and that's really popular now?
Yeah, just not, and anything in moderation. So don't rub the skin aggressively. Don't overheat the skin. I've had some really disastrous cases where patients have come to me and they've been microneedling themselves based on a YouTube channel, and then they've got these track marks from where they've been doing the microneedling really aggressively, where they think that the more pigmented, the more aggressive I'm going to microneedle at home. That absolutely leads to worsening of melasma. And I recall this other beautiful patient of mine who is an African girl who bought street bleaching products. So that's my other no-no. Don't buy street bleaching products. So she bought these products that were imported from Africa over the counter in a market, and she just wanted to be so much lighter skin than she was. So she, for about a year and a half, applied vast quantities of these ingredients that she had no idea what they were in. And it's very, very, it is a case that will never leave me, because these products contained high dose steroids and very, very high dose hydroquinone. And now she has permanent skin damage and thinning, and she has these sort of like confetti-like patches of hypopigmentation on her skin, and it's sadly permanent. So just only use reputable brands. Don't, that's very, very important. Don't buy anything on the black market. Be careful with what you buy on the internet. Just because they say it works, it doesn't mean it does. So that's what not to do. Then what to do. So consistency. So, and sometimes not overdoing it. So having your own routine of trusted products that you use with very, very good effective ingredients. So in the morning, cleanse your skin, moisturize with active ingredients. And then, of course,
can I just interrupt you? What active ingredients do you like for people suffering from pigmentation? What, there's so much information. You're a dermatologist. What would you say if we were to pick some top key things to add? What would we be doing?
Yeah. So ingredients and brands are much like clothing. There's so many different brands of clothing, and like which one is the best, which one works. Skincare is a bit like that. There are so many vast brands out there, and really they'll all get you from A to B, but it's just about how much ingredient. And there's no one ingredient that works. It's just about using something, trying it and sticking to it. So all those ingredients we talked about, azelaic acid, kojic acid, those sort of ingredients, glycolic, salicylic, they're all very, very effective for if used consistently. So I just like to say that people are always saying to me, what's the one brand or the one ingredient. It's about sticking to something and sticking to trusted brands. The brands that have been around forever are around forever for a reason. They are around because they work, and they've been shown, they've never disappointed people, they've never harmed people. So I like to advocate brands that have been around and tried and trusted and have evidence behind them. So I don't like to sort of say you must use this one ingredient and it's going to work. It's just about keeping at it and not expecting results in 2 weeks.
So you mentioned vitamin C before is a great product, or green tea. Would that be as part of so you'd cleanse, you'd use something with vitamin C or something in the morning?
So you apply your products thinnest to thickest. So I would cleanse and then use a serum, because it's a very thin product. The serum delivers high concentration of active ingredients to the skin. So I'd use a serum with a specific ingredient in it that you have at home, that is an effective ingredient, as we've just mentioned, all those different products to try. And then I would moisturize, and if I'm worried about pigmentation, I would have an ingredient in that product that helps the pigmentation. I tend to get a bit of rosacea, so I'll add in some an anti-redness treatment for me, but we're talking about pigmentation, so you want to stick to those products that reduce pigmentation. And then, of course, it's boring, we all know it, but sunscreen, and understanding sunscreen is very important, because you want to cover the full spectrum of UV. So UVA and B, a broad spectrum sunscreen, is super important, because people don't understand that UVA penetrates through windows, and it's a very important spectrum to consider. SPF only measures UVB predominantly, so you want to ensure that you're using a UVA blocker within your sunscreen. So I hope that's answers your question.
It does. I do have a question with the Clinique Even Better Clinical Dark Spot Corrector. It's not a moisturizer. It's a serum, right? It's just a serum.
Yes,
it's a corrector.
Predominantly a serum. Predominantly, it's very, very, very good. I mean, there are. This has
do you
been
use it
shown
morning
to
and
hydrate
night,
the skin.
Morning and night.
I did use it. For me, I used it morning and night, because I wanted results. I wanted to get results quickly. It has been shown to hydrate the skin up to 92%, so it definitely will hydrate. Serums can hydrate, as you know, but the older you get, the drier your skin gets, and melasma tends to affect people between their 20s and 40s. So, you know, at the 40 end of the spectrum, a bit drier than the younger skin types. So, so I tend to go thinnest to thickest, cleanse, serum, moisturizer, and then, you know, depending on what my skin looks like that day, if it's really dry, I'll add in an extra moisturizer. And similarly,
I don't know if you know this, but Even Better has foundation in the range, and I use it, and it's really nice. So it's got some of the clinical ingredients in a foundation and SPF. So it's actually quite a nice product, and it disguises pigment quite well.
I have it on today, actually, on my nose. So, it's a very good foundation. So,
one last question before we wrap up. Is it ever too late to treat pigmentation? Like, is you mentioned, you know, for some people, they've really, the pigmentation is really settled in. Is it ever too late?
Well, I don't think it's ever too late. When does a woman stop caring about her appearance? I mean, I have 80-year-old patients who still want me to help them with their skin. You know, why do we ever stop caring? When you stop caring, it's sad, isn't it? So no, it's never too late. It's never too late. But the interesting thing is melasma improves with age. You don't see too many people who are older getting it. It tends to be sort of, So post-menopausal, once you get past that menopausal area, pigmentation becomes, that melasma type pigmentation becomes less of an issue. So that's a win for you out there, girls.
It sure is. And Dr. Nina, since, you know, the podcast is called Ageless, can I ask you, what other things that you've done in the past 10 years that have really transformed your vitality and, you know, your beauty personally, not for patients, but as a woman who's kind of that we come to become ageless? What have you done for yourself that's really given you some bang for your buck?
Yeah, well, I'm a big advocate, as I know you are too, that beauty is inside and out. So I truly believe on working on my mindset, my attitude, and self-belief. And I believe a lot of beauty comes from what you do for others and what you give to the world. So that is a big part of my philosophy, that I always believe that my true beauty comes from what I give to others. But that's a deeper conversation, but I believe in that a lot. On the outside, and also, of course, you know, beauty is about being healthy, about the energy, you know, that you bring to a room, in addition to being healthy and exercising and doing your best to eat well, and you know, that those sort of more broad terms. But in terms of external things, of course, I like, my biggest winner, of course, has been, you know, I own a laser clinic. So my business partner and I, for 20 years, have always worked on our own skin. We've always done a resurfacing laser every year. We consistently use products. And so I'm very fortunate in the sense that from that sort of sun perspective, I can rectify some of the damage I did. Because when I was young, unfortunately, I used to have tanning competitions with my girlfriends before I knew what I knew now. So sadly, I've created a bit of my own damage, which if I could turn back time, I would change. But I think agelessness to me is that beauty is ageless. It is ageless. Beauty is an attitude. an attitude to me, and I can sense it in people. And when I see them as patients, I think it's about embracing life and living your best life, and not letting things stop you, believing that you'll always find a way around things, and gratitude, just being grateful for what you do have in life, not what you don't have, and not focusing on what you don't have, but focusing on, just appreciating life, I suppose. Is that the sort of answer you were?
No, I just think it's really interesting, because it's in your hands that we entrust our agelessness. So it's nice to know that you also have a personal plan for being and, living ageless. I want to thank you so much. It's been an absolute pleasure speaking with you. And I want to thank Clinique as well for making you available to us, to our audience. I know that you have a partnership with them, but really the information that you've shared is so professional and so expert, and it's been a pleasure to have you on Ageless by Rescu.
Thank you so much for having me. I've really enjoyed our chat.
It's always good to talk to you. Mwah.
Yeah.
Bye, Dr. Nina. Thank you. What a pleasure. I hope you enjoyed this episode, and if you did, please share and rate this episode. I'd love that.